As we reported earlier, the Palestinian Health Ministry has detected the first confirmed case of polio in Gaza in 25 years. It was found in a 10-month-old baby in Deir al-Balah who had not received the full polio vaccination. Dr. Yasser Khan is an ophthalmic surgeon, humanitarian and entrepreneur based in Canada. He was in Gaza earlier this year for a medical mission. He joins us now from Vancouver. Good to have you with us, Doctor. You've been on the ground in Gaza treating patients during the war. How do you believe have the conditions there led to the first case of polio in Gaza in a quarter of a century?
Thank you so much for having me. Well, I've been there twice now, and last time I was there was March, and it was just simply catastrophic. I mean, this has been really a war on the healthcare system. All infrastructure is gone. 70,000 tons of explosives have destroyed sewage pipes. So you have sewage water mixing with drinking water. And even when I was there, between the tents, you could see sewage water seeping. Even in the hospitals, because of overload, the sewage system broke down, and you had sewage and emergency departments in clinical rooms. And along with the lack of potable water, lack of hygiene product, lack of proper sanitation, I mean, it's been a horrible cesspool of infectious diseases, and it's only gotten worse in the last 3-4 months since I was there last.
Now, the UN wants to organise 2 7-day polio vaccination drives across Gaza to immunise more than 640,000 children. Do you believe that's possible, given the conditions in Gaza right now?
Well, the problem is that the bombing and the missile strikes are ongoing, and the orders to evacuate are almost constant. So you have these people being displaced from one safe zone to another safe zone, so they're always on the move. Even yesterday, there was evacuation orders given. And so to vaccinate 600,000 people in that environment, you have to get medical teams to the sites. You have to actually account for all the people that are moving who are in constant displacement multiple times. To do that when there's an active bombing going on by the Israeli forces is virtually impossible to do. You need an immediate ceasefire completely, a permanent ceasefire, to really tackle this problem. It's not going to happen otherwise.
And Doctor, how concerned are you that we could see a polio outbreak spread across Gaza and even beyond?
I'm very concerned. I mean, even being on the ground, you walk through sewage water. You walk through people having no access to bathroom facilities, hygiene products. I mean, there's 2 million people who are basically 95% of the population is displaced, living in tents without proper hygiene. So not just polio, there is hepatitis A, and there's other severe infectious diseases that are going to spread, and we will lose thousands of people. Even if there's a ceasefire called today, thousands are still going to die. So I'm very, very concerned, actually.
Okay, Dr. Yasser Khan, we will have to leave it there. Thanks so much for joining us here on the program.